What's the typical age range now for this population?
So the largest demographic is the 18 to 34. For the longest time, the largest demographic was 18 to 26-year-old males specifically. It's now expanded in age range, mostly because a lot of us who grew up playing games of some variety are now adults with full, well-paying jobs. We can then spend money on more games because that's what adults get to do. It's also now much more, there's much more gender parity than there used to be.
Hi, I'm Stephania Bell, senior writer and injury analyst for ESPN. As you may know, I'm also a physical therapist, and the foundation of my current career was built in the world of orthopedics and sports medicine. Through a collaboration with APTA Orthopedics, I'm hosting a podcast series. I'm thrilled to be able to share with you conversations with some folks who I consider to be leaders, pioneers, and trailblazers who in some way impact our world of physical therapy. I hope you'll enjoy.
Hi, I'm Stephania Bell. I'm a physical therapist who works at ESPN, and I am thrilled to be working on a series with the APTA Orthopedics group, looking at people who are leaders, whether it's in our profession of physical therapy, interdisciplinary, people we might interface with at different moments in time, but somehow have exemplified leadership through what they're doing in their professional work and sometimes outside of their professional work. I'm thrilled that today I'm going to be joined by Dr. Caitlin McGee. And Dr. McGee is a physical therapist who's also board certified in, is it neuroscience or
It's neurology. I'm a neurologic clinical
the
specialist.
terms are changing all the time. This is
I
what
know. As of 15 days ago, it's very new.
Well, that's why you're here, to educate me. But I can tell you what they were back when I got my orthopedics board certification. But neuroscience, and you also have a background in exercise and sports science. But the real reason I wanted to bring you in today is because something that's near and dear to my heart. You have carved out a completely different niche within medicine, actually, not just physical therapy, but within the world of medicine. And we'll talk about whether that is sports medicine as well or not. You may have some strong
The
opinion
eternal
about
debate.
that. I can't wait to hear about that. But really, you have taken this unique path, and it's so unique and relative to the world of medicine. I think relatively new, although I know you've been doing it for quite some time. But I wanted people to hear your story, not only because of the nature of the work that you're doing, but just how you forged a path where one didn't seemingly exist. I was lucky enough to get to meet you because in my line of work, I was looking for someone who could help me with athletes who were injured in esports competition. And I'm going to just leave it at that and go back and ask you some questions just to sort of tease that a little bit. But let's get basic. How would you define esports for people who might not be familiar?
So we can go with two different definitions, and one is the nice one that sounds slightly fancy and scientific, which at least in the physical therapy sphere, we can think of esports as a static endurance activity that tests cognitive function in a virtual environment, which is why we can gamify the heck out of it and use it for stroke rehab. The way that we describe it to a non-PT person is it's competitive video game. You're playing video games, possibly for money, maybe just because you really like it.
Well, all I know is that when I learned about it, it was because here at ESPN, we were writing about it. And there's a variety of sports, many of which were not known to me when I was younger. I don't know if they've come along, who knew there would be television about cornhole competition? But I saw what was happening in this world at V Sports, and I get asked to touch on a lot of different things with what I do at work. And I've always taken the approach that I have to be like a physical therapist. If someone walked in my clinic and I didn't know what it was that was what they did for activities of daily living or their functional demands, I would have to go and research it. And in the course of trying to find out more about injuries to some of these higher profile esport athletes, I came across your name. And you helped me tremendously. And when I had to write an article about somebody who was being forced into early retirement
Mhm.
because of these injuries. So, um, if you could, there's so many questions, but I want you to start by, uh, now that we've defined esports, how you manage to align yourself with that.
Sure. So it was not a place I expected to end up. It's not as though I was some kind of lifelong esports competitor myself. I played video games. Most of my generation does. Um, I got into esports though when I was on my clinical rotations, studying for boards and going absolutely insane, doing both of those things at the exact same time, as many of us PTs can relate to. And I found a number of online gaming communities as a really nice place to connect with people and to just enjoy something that we found competitive. I also really enjoyed the stats side of things. I loved the nerdy aspect of breaking down the games, whether it was looking at frame specific data in Street Fighter to see like what move is going to come out first. And if you hit them both at the same time, is one faster than the other? I loved it for Dota 2, Defense of the Ancients, which is like a 5v5 capture the base kind of game, where you get to look at all these different dynamics between how certain characters chosen for a team can interact with each other. It really appealed to my love of regular sports stats. I played soccer growing up. I did track and field. And you get to a point where there aren't really too many track and field competitions left for you after you leave grad school. But there's got to be something competitive left on the board for you. And well, I was never going to be a competitive marathoner. I do that just because I'm slightly insane. But games I could be competitive at. So I started playing while I was on clinical rotations. Really enjoyed it. Enjoyed the people. Enjoyed the act of playing and understanding these games. Didn't so much enjoy going to tournaments, especially doing stats at tournaments, and finding that they had the exact same chair for everybody, from like the 16-year-olds who were still growing to the couple of 30-year-olds who were still playing. At that point, 30 was old in esports. We've pushed past that now. We're good. They had the exact same equipment. It was not very individualized. Half the people were sitting like shrimp. That's the only way I could possibly describe it. To be fair, I occasionally sit like a shrimp as well. I will later soapbox about ergonomics. Uh, but I got a chance to see what folks were dealing with. And while I was on site at tournaments, I would occasionally be like, "Hey, I noticed you keep like rolling out your wrist like this. Does it hurt? Can I give you some advice?" So players started to know that I was somebody they could ask about that kind of thing. And then I got on Twitter, um, back when it was still Twitter, and while it was slightly less of a what it is
Toxic.
now. We'll go with that. Diplomacy. And back then, it was a really great way for the esports community to connect. And I would give people, kind of ergonomic feedback online, or they'd ask questions about, like, hey, it really hurts when I do this thing. And I was like, I'm not your PT and I can't treat you, but here are the muscles involved in that motion. Let's talk about how to strengthen them. That got me connected with a couple of other PTs who loved the same thing. Eventually, we were able to kick off a company together, and we worked quite successfully together for some time. Um, but while I can't say I exactly just stumbled into esports, because that wouldn't be accurate, I certainly landed at just the right time because there was a need and I wanted to help fill it.
That is how so many people who create their job path do it. You see a need, and you just happen to be the person to fill it, and you step in at the right time, but it doesn't come without a lot of preparation. How did you know that your background would, and you were at that point very new in
I was
your
a brand
career,
new baby PT at
brand
that
new.
time. Yes.
So how did you have the confidence to say, I know I could do this?
A big part of it was I knew how much room I had to fail, which is to say, I was working a perfectly normal, perfectly reasonable day job as an acute care PT, that I had to fall back on. I knew that I had runway in terms of I was young enough to try something that was a little bit of a risk. And if it didn't work out, it wasn't as though I was like blowing my retirement savings and I had no time left to recover. So I had some time to fail. Um, but I did do it kind of as low risk as I possibly could, which is to say, I didn't go full force into esports until I was 8 years into working in esports. I maintained a regular daytime PT job, either in acute care, in outpatient orthopedics, or in inpatient rehab, depending on what phase of my life we're talking about. And knowing that I had that to fall back on made it feel, yes, it was still a big time commitment, but it didn't quite feel so much of a financial risk, which was the biggest aspect of security that I was cautious about. It was also just fun. Like when you get to do something that you really like. I don't fully subscribe to the if you do what you love, you'll never work a day in your life. You are going to work, and it's going to be hard
I
sometimes, and you're
agree.
going to have these weird boundaries of your work and your life. But you're going to get to enjoy the work that you're doing a good deal of the time, even when it feels hard, even when it feels strenuous, and you're going to be around people who feel similarly. That was the other nice thing about it. It felt like less of a risk because there were a couple other people who were also interested in doing it, who also had no idea what they were doing and were willing to explore that alongside me.
What do you remember about the first time you realized you were actually helping these patients in a
Oh, I
way
remember
safe?
exactly when it was.
Okay.
It was Genesis 3, which is a big old Super Smash Brothers tournament that happens out in California. And I'd put together an ergonomics guide for Smash players because there were a lot of Smash players with hand issues, including one who like notoriously had a reputation for refusing to go to the doctor. It was a whole long-standing in joke in the community. I put together this guide, and I messaged somebody that I knew in the community, and I was like, "Hey, I've got this put together. Do you think it would be useful?" And it was the night before the finals of the event, like the big, like final two playing off for who takes home the gold. And she was like, "Yeah, absolutely. People would love that." So I posted it, and she retweeted it, and a couple of other people retweeted it. And because they were all showing it to each other at Genesis, it got so much attention and so much kind of runway
Mhm.
that it just really it gave me such a good jumping off point for a whole bunch of people to want to connect. And that's how I ended up getting hired to actually go to tournaments and be their on-site medical person. Um, it was a really big turning point for me, and it's also how I met some PTs in California that I later ended up working with.
So many, I mean, there's so many natural questions that evolve from this. But when you say they brought you to California, can you describe that? Like, were you paid to come out? Was it,
Yep.
people always want to know. I mean, I hear you saying, and I love the fact that we have cats going in
Yep.
and
The
out
cat's
of
going to
this.
wander across the camera as a cat's
I love it.
prerogative may
I
be.
love it. Animals are welcome. Uh, but people always want to know, if I do something, am I going to get paid for it? Do I have to do some work, you know, pro bono, essentially, to get adopted into the community? And then at what point is somebody going to pay me for my work? Because you also recognize that compensation sometimes equates with value. And can you explain a little bit about that transition,
Sure. And esports is
specifically
a
from this side where they were volunteering to pay you to come and be there for them?
Esports is a weird place for that, for a couple of reasons. One, because esports it's an umbrella term, but it's not a monolith. Esports encompasses everything from big professional productions where sponsored teams where the players are paid millions of dollars per year, come out and compete at like a production studio with top tier
Mm.
equipment, to grassroots, somebody's hosting this in their basement kind of tournament. So esports encompasses all of that. I absolutely started out doing a whole bunch of pro bono stuff because nobody was doing PT and esports and nobody knew what PT and esports looked like. I was lucky enough to live in DC, which is an area that has a lot of gaming that happens in it. So I would reach out to local tournaments and be like, "Hey, can I set up a booth for you guys? And can you waive my booth fees?" And they were like, "Sure, we will waive your booth fees in exchange for you being allowed to be here." It's definitely a careful balance of whether or not you're doing pro bono work and for how long you're going to be doing it. In this case, it was necessary in order to make an inroads because at the time that I started, the concept of esports medicine didn't even exist. That was not a term that we came up with until I was 3 years working in the industry. I was just a PT who did esports. So it absolutely was necessary to start out doing pro bono. And the next step after that was being paid for travel, but not necessarily paid for the work. So they would cover flight and hotel, but I was responsible for, meals and incidentals and all that.
And when you say
And
they, just to be clear, who was they?
depends, very PT answer right there. It was sometimes the organizers of a tournament. It was sometimes the owners of a team who wanted me to come out and work with specifically their players. Um, More often it was the tournament organizer, though, if that was something they wanted to make available to anybody who was attending on site, to just have this kind of PT booth available.
So then they would bring you out, and initially it was the travel fees and all of that. And then how did it evolve from there?
I think it really helped that more people in more disciplines were also starting to get into esports and were starting to be hired by teams on like a full-time exclusive basis. It really helped to show the value of what we could do, to actually insist that, hey, there's enough value that you need to pay me for it. And because there was such a small number of people in this esports medicine industry, in the esports medicine niche, we were able to talk to each other about like what pay rates looked like,
Mm.
which allowed us to advocate for fair rates. I will fully acknowledge I was terrible at setting my own rates to begin with. I was basically setting my hourly rates based off of the equivalent of what I got paid at the hospital. Which, like, side note, $40 an hour might be reasonable when you work in an acute care setting with full benefits packages. That's not what you should be charging when you're an independent consultant. Took me about a year and a half to learn that one. But once I was doing that, and once others who were also working in the industry were kind of being consistent with what we considered the value of the work that we did, that really helped not only to actually get paid, but also to improve the perception of it's kind of like the Franklin effect. Franklin effect
Mhm.
being where if you ask somebody to do a favor for you, they are inclined to view you positively because, well, they'll retroactively justify it as I must have liked you. If you're charging a rate and they pay you the rate, they're more likely to look back at it as, yes, this must have been worthwhile. I wouldn't have paid them otherwise.
That was exactly what I was getting at with the whole setting the value
Yep.
proposition for it. It's like the high tuition is perceived sometimes as a higher value because you're paying more
Yes.
for it.
Yep.
And so I find it really interesting that you say that as more people like you, whether they were PTs or other medical professionals, were getting into it, and you obviously collaborated to some degree to come up with what was fair compensation.
Mhm.
Um, that's interesting because in this world, a lot of people might be out for themselves, and I'm sort of
Oh,
surprised by
there's
that.
absolutely plenty of that
Oh,
as well. It's just I I sought out and cultivated connections with the kinds of people who are a little less cutthroat and a little more like, let's get more people into this industry because we've got more work than we could possibly do right now. It's not a, well, I'm just going to charge more money and I'll see more people. You're going to run out of time in your day. We genuinely needed more folks in esports medicine.
what other professionals are in esports medicine right now?
The biggest, I'd say the biggest group other than the rehab professionals, which I'm grouping PT, OT, physiatry, physical medicine types folks. The other really big area of practice in esports medicine is the psych side of things.
Mhm.
Whether that's mental performance coaches, whether that's actual clinical psychologists, that's probably an area that has even more impact on player performance than physical performance does. Like I'm not gonna toot my own horn so much that I think that there's not a place for psych. And honestly, I think if teams were deciding between we could only hire one full-time person, your players are probably gonna need the mental performance and the mental health support even more so. Just, refer out to us afterwards.
Why is that?
A big part of it is the significant prevalence of neurodivergence in the gaming community. There's a lot of us there, me included. I'm included in the us. A lot of it is it's competition. Anything competitive is difficult and challenging in and of itself. Add to that the financial volatility of esports, the fact that you really can't make a secure living off of it unless and until you are one of the top tier teams. There's a lot of pressure imposed on you in that. The practice schedules are insane. A lot of players are practicing upwards of 10 or 12 hours a day. And then when they're done with the actual formal structured practice time, well, what do they do to relax with their friends? They go play games.
Ugh.
Um, then there's the aspect of it's still so new, so there's some stigma around it. There's often disconnection from family or from friends. There's the fact that esports is played across multiple time zones, so you're often staying up very late or getting up very early, which means disrupted sleep patterns, which also affects mental health significantly. Um, So all of those factors together really impose a psychological burden in the same way that competition in sports or even participation in something like, I don't know, if you were a professional musician, there's a strain and a stress that that puts on you.
How does, and actually, I'm going to back up because now I find myself hesitating. So I want to ask you right now, and this came up, as you can imagine, when I started looking into this when I was at ESPN. Are esports players, participants, athletes?
Ah, that's the question that we've always gotten every time when we want to go talk to anybody who isn't already in esports. The question is always either, are esports competitors real athletes, or are esports really sports? And my answer is, who the heck cares? It's a giant red herring, and it's a giant red herring that I'm very passionate about because it doesn't actually matter whether esports is a sport or not, with the asterisk of it'll matter for some regulatory purposes, for some liability purposes, and figuring out whether you group it under res life or the sports or the athletics department at a university.
Yep.
But when it comes to physical therapists, it does not and should not matter whether or not esports is sports or esports competitors are athletes. This is a population with unique and specific demands that we are uniquely capable of meeting. So yes, I suppose it matters a little bit for PT as to whether we should be trying to make an esports special interest group underneath the sports special interest group header or somewhere else. But for the day to day practicing physical therapist, it does not and should not matter. What matters is figuring out what their needs are.
It's a great answer. It's interesting because obviously I work for a sports network,
Right.
but it comes up in the context of their competition, their and we see more, and I say we in the group that's like the generally informed, but not super well informed. So exposed to it, but doesn't know all the nuances about it. It's got sports in the title. There's competition.
Yeah.
There are financial rewards, and we're seeing scholarships.
Yep.
And people are being recruited
Yep.
for college. So I think from that perspective, it's got all these different things that track with what
Right.
we
Which is
put
why
in
I
categories.
really like the definition of esports as a static endurance activity that tests cognitive function in a virtual environment. Because sure, it's a little bit flowery for a sport, but it does accurately describe what the nature of that competition looks like, where the load is placed. It's endurance activity. It's a static endurance activity, and there's cognitive load. The other thing is, we know that esports competitors get injuries at a reasonably high rate. So clearly there's some amount of physical strain going on in the process.
Right. You mentioned the ages a little bit before. What's the
Mhm.
typical age range now for this population?
So the largest demographic is the 18 to 34. And for the longest time, the largest demographic was 18 to 26-year-old males specifically. It's now expanded in age range, mostly because a lot of us who grew up playing games of some variety are now adults with full, well paying jobs, which we can then spend money on more games because that's what adults get to do. Um, it's also now much more, there's much more gender parity than there used to be. Women have been present in esports from the beginning, but there's a lot more representation than there used to be. There are women's leagues, there are women's only tournaments, there are teams that are mixed gender. Um, but the demographic does still tend to skew a little bit younger. However, the second largest after that 18 to 34 is the next generation up. And I predict that by the time I am living in a retirement community, we will have like Counter Strike retirement leagues, silver shooters, if you will, rather than silver sneakers.
That's awesome. It really has, I see it because I feel like when I started witnessing the surge, and so I can see that this is going to be a multi-generational thing. Going back to the different disciplines, do you have a team of providers that you've cultivated that you work with for cross referrals and such, and how did that come about?
So I made an interesting transition about a year ago to primarily academia. I mostly teach now. So I'm a little less involved in the day-to-day clinical work, but I can definitely describe what that looks like for the work that I did on a day-to-day basis for years, as well as what it looks like for other PTs who are still doing that. Um, when I got started at 1HP, which is a multidisciplinary health and performance company, we just had PTs. Over time, that became PTs and athletic trainers. That became PTs, athletic trainers, and psychologists. PTs, athletic trainers, psychologists, and mental performance coaches. We also have a go-to OT that we've consulted with. She happens to be my sister. It's very
Yeah.
convenient to have an OT in the family as well. She's also a CHT. So having that
Oh,
certified hand
wow.
therapist
Perfect.
available to consult with is just the best. Um, we also worked with other providers overseas, so physios in Australia, as well as some psych folks in the UK. And then there are other teams that have done it slightly differently. For example, Evil Geniuses at one point had a physiatrist that they hired to kind of oversee their in-house care team with physical therapy and psychology on board with that as well. So I've been lucky enough to cultivate some pretty great connections along the way. And the really nice thing is, not only do we know this as PTs to be the best way to go, it's holistic, it's multidisciplinary, it's don't silo care over here. Um, Among the actual research in esports on esports health, there have been several papers looking at the multidisciplinary healthcare model and finding that unequivocally, this is what works best for player health and performance.
It's interesting that you mentioned the research. I am going to come back to that. I just wanted to ask you one other question about basically like fitness levels and conditioning and training. How have you seen that evolve in your time in esports? Because from the little bit that I've read, it sounds like none of that was happening before. And I read about a couple of clubs in Europe who then hired some of
Mhm.
these other folks so that kids weren't just they recognize that you had
Yeah.
to have other kinds of training, and hey, how about this, nutrition actually improves performance.
Yep.
And so they built in, it's like all of a sudden now, just like any other team where you might see them having all these different folks who were consultants or part of a training regimen, that they did that and they improved their club's performance. So have you seen that change?
It's been really fantastic to see that change. And the data has so the most recent study that we have looking at rates of physical activity in esports competitors that I can like cite from memory is one that Dr. Joanne DeFrancisco Donahue did in 2019, which looked specifically at a small subset of collegiate esports competitors, and 40% of them were involved in regular physical activity. However, in the following year, a study came out, and players recognized 65% of them said, "Yeah, I'm pretty sure that physical activity improves my performance." So there was an increased recognition that it did, in fact, make a difference. In the same vein, we found that a 6-minute walking break while playing actually improved performance after returning from that break relative to just sitting there doing nothing. That was another Dr. DeFrancisco Donahue study. um, when I first started in esports, not only was there no research, there was very little awareness by the players that this was a thing that they should be doing. The only model that was really available for training that most people tended to subscribe to was what was called the Korean model, and this was based off the fact that a lot of the Korean StarCraft players were kind of they were the pioneers of like absolute dominance in their area of competition. So everybody was like, well, clearly whatever they're doing is working, so we must emulate it. And what they were doing was grinding for like 12 hours a day, which for a lot of teams was exactly like, all right, that's clearly what we must do. We need to just play this game for 12 hours a day to make ourselves the best possible. Um, which can you imagine doing that for like a regular traditional physical sport? You're going to spend 12 hours, you fall apart. No wonder esports athletes, esports competitors retire so much younger than regular
Right.
traditional sports peers. Um, so there was not as much awareness of what to do outside of just playing the game that would facilitate improved performance. About 3-ish years into me working in esports, there was this kind of subtle shift from pain is inevitable, I'm just going to hurt, slash pain means that I'm working hard enough, I've been playing hard enough, to, oh, wait, maybe I shouldn't be in pain. I should do something about it. And about 5 years in, there was a shift to, oh, wait, I bet I could prevent this pain in the first place instead of reactively seeking healthcare after the pain has already started. And then about 3 years after that, there was really this shift towards I bet not only could I prevent myself from hurting, but I bet I could make myself a better player by being more physically capable. And I by no means me nor anybody else in esports can take full credit for that. That is absolutely not a thing that we can say like, oh yeah, PTs came into esports and everybody realized this. There was an ongoing shift. There was a big push towards overall health that was coming from the communities themselves. But I'd like to think we facilitated it at least a little bit by getting a lot of players to the point that they realized, oh wait, I don't have to be in pain and I'm still really good. I don't need both of those. Okay, both of those things don't have to co-occur. Great. What else can we do? So a lot of times when we worked with teams, what we would do is try and implement the changes that would make the most impact first, which was not in fact physical activity. It was nutrition and sleep.
Interesting.
The biggest, most immediate impact from getting them from like 6 hours of sleep at night to 8 hours of sleep at night. And they're like, this is amazing. What else can you guys do for me? You get buy-in when you get that feeling of I feel better, I'm performing better, I'm not tired during our mid-afternoon video review. And then they'd believe you about other things.
Right.
So I think that definitely helped with the progression for sure.
You mentioned that there wasn't much research in this lane, but it's coming along. I mean, I'm certainly seeing that more things are published.
Oh, for sure.
And you are now an associate editor for the Journal
Yes,
of
I'm an
Electronic
associate
Gaming
editor
and
over at
Esports.
the Journal of Electronic Gaming and Esports, which was an absolute delight and honor to kind of take on that role as of last year. JEGE started out prior to that. Obviously, I was just a contributor at first, and then they were like, "Hey, you interested in reviewing other papers for us?" And I was like, "Yes, absolutely." And apparently, I did a good enough job as reviewer too to get promoted.
How long has this journal been around?
I believe JEGE started in 2019.
So this is
Oh,
really in the world,
2017, sorry, 2017.
still in the world of journals as we
Brand
traditionally think of them.
spanking new in terms of journals.
This is really new. But
Yeah.
it also speaks to the fact that there's enough interest and research being done to support a journal.
Oh, even better. There's not just one journal. There's technically three, but only two of them are really actively publishing. There's the International Journal of Esports as well. We also see plenty of papers being published in traditional research journals.
Mm.
Frontiers did a special edition that was esports focused. We've seen stuff get published in PT Journal. We've seen stuff in psychological journals as well. And there are esports specific research conferences at this point. The Esports Research Network, which is global at this point, hosts one annually. This year is going to be a 72-hour, like 8 time zone, co-hosted by 4 different universities. And it's amazing because we've got enough research to support something like that. And the breadth and the depth of the knowledge, we're getting everything from, health and performance to the environmental impact of travel for esports to the psychological load associated with esports to how do you create an inclusive and welcoming environment. How do we deal with issues of gender, race, and sexuality in esports? What kind of biases do we see occurring? How do we deal with some of the tech issues in esports? And one of the really great things about having these big, broad esports journals that all of these things can go under is we're not siloing any aspect of care. It's no longer just we're not siloing PT from psych, from nutrition, from sleep. We're no longer siloing medical and healthcare from all of the other context that exists within esports. We can only provide good care within good context. So the more interdisciplinary our research can be, the better our results are going to be.
I even see in covering the teams I do that when the nutrition and those folks are, whether it's a dietitian that they have on staff or somebody else who's tracking some of the wearable data, which
Mhm.
I'm sure they're using some of that.
Oh,
And
we are, yes.
also, it makes a difference in terms of it all benefits the patient, whoever
And when
that.
we even drew on that when we were starting to do esports health research and esports medicine research, there wasn't really any data on rates of injuries in esports or what we should do about like a kind of slowly developing tendinopathy. Um, but there was lots of data on musicians, professional musicians.
Mhm.
There was lots of data on the impact of sleep deprivation on third shift workers, folks who were staying up super late. There was lots of research on the impact of travel across time zones on traditional athletes. There was lots of research on the cognitive demands placed on air traffic controllers, people who sit for a long period of time doing a cognitively demanding task. And so we were able to pull information from all of these diverse areas of research to inform the beginnings of our practice, and then to learn more about esports specifically based off of those kind of nice steps we'd already been started up.
It's so interesting. I could talk to you for hours about this, but I'm hoping that at the very least from the conversation, we're sparking some interest, and awareness, which is equally important. I think for folks who might not be as familiar with this area of work, I do know that you have a textbook that's published. I asked you to bring it with
I
you
do.
because I wanted you to show a copy
I
of
do.
it
I do. I
today.
have it right here.
I think it's the coolest thing ever. Handbook of Esports Medicine. I mean,
The Handbook of
how
Esports Medicine. We're actually,
is it
as
now
of like,
required text for your students?
no, I would feel bad like if I was making that. All right. I will say when I teach an advanced elective on esports, that will probably be a required text, but it won't be this version. It'll be volume 2 because we're doing a revision this year actually.
Already
And the
that's
really great thing
impressive.
about this revision, I get to do a little teaser for it now. We're bringing in more folks for it. So the original edition was me, Lindsay Migliori, and Melita Moore, and we're all absolutely still contributing to it. But there's so many more people in esports now. We get to draw on their knowledge and their experience too. So we're bringing in that breadth, we're bringing in that depth, and we're having some really great folks who've done research and folks who've done clinical practice contributing to this text. There's also let's see, there's the human kinetics textbook that came out as well. I was a contributor on that one for upper extremity injuries specifically. And then I've also got another one in the works with McGraw Hill that's looking at physical therapy and esports specifically. We're
Oh,
calling it
wow.
Game Strong, it's just all about how PTs can be incorporated into esports and working on the specific kinds of demands that esports players are going to face ergonomically, physiologically, competitively, with the important context of what's esports culture look like and what are you stepping into.
That's a perfect segue because I was just going to ask you for people who might be interested in this or who think I may be able to tap into that in my practice. I might want to seek out these patients or develop a relationship with folks who might need it that haven't been able to identify somebody with my expertise who could help out. How would you guide someone either, as a new student coming out, because there are differences, if you're a new student coming out, you may have heard about this already, maybe more familiar. Certainly for some of us who were, or, we won't say what stage of practice, but, as you advance in your
Experienced practitioners.
the experienced practitioners who might think, well, this might be a group I'd like to tap into, but I don't have any idea how to start. What would your recommendations be for those two different sets of folks?
Oh gosh, definitely can make a couple recommendations there. First one for everybody is checking out the Esports Research Network in the first place. Check out Esports Research Network, check out the Journal of Electronic Gaming and Esports if you just want to get a kind of baseline sense of what do we know about health and esports currently. Um, for folks who are still in school or have recently left school, check out what kind of esports programs are at your institution because a lot of universities now have either club or competitive esports programs. And so the opportunity to potentially get involved with them, either as someone who's just observing and coming to listen, or if you've got the appropriate clinical supervision for it, as someone who's able to provide some degree of care or assistance, is massive. That's a fantastic opportunity. It's one of the things that I love about Harrisburg University. Going to brag about my university there for a second. We've got a varsity esports team, the Harrisburg Storm. And so we're able to work with and work to support them. For folks who are already a little more established, who are out in the field and have done this kind of work for a little while, I still really highly recommend looking for opportunities in your community to either find a place that does what's called LAN tournaments or in-person competitions. If you're in a major like metropolitan area, I guarantee there's at least one and probably more. Down here in the DMV, I can think of like 3 off the top of my head. New York, even more so. Um, so finding those in-person places and getting to know the folks in the community. There's a definite degree of reasonable skepticism in the esports community writ large because a lot of folks have come in to try and make money off of esports,
Mm.
get their bag and get out, as they put it. Um, There's also a lot of folks who've had not great experiences with healthcare practitioners before because they've gone for a wrist issue or an elbow issue or a neck issue and been told just play less, stop gaming, don't play as much video games. They're not good for you. Or have been told this is a catastrophic injury and we're going to have to do surgery on you because the first place they went with an orthopedic surgeon and not a PT necessarily. So you have the opportunity to be someone's first experience with healthcare as an esports player. So you have the chance to sit down and listen to them and do what we would do with any patient to understand their unique and specific demands. And sure, if you want a little bit of a shortcut to know, like, what are some good questions to ask and what should I listen to? Yes, my textbook is great for that. Um, but all of us who work in PT are trained in those the way to do a solid subjective interview. Even more so with esports, it's really key because that's where we develop all of the rapport. So find your local community options, look at the universities near you in particular, and you're probably going to have to get online at least a little bit. Twitter, Blue Sky, Discord are all places where online hubs, online communities of gamers live. The other thing I would suggest, this is your official doctor's note. Go play some games. You have to do it for professional reasons. You don't have to be good at them. Lord knows I'm not. But you do have to be familiar with them. And the more you're familiar with them, the more you're able to connect with and relate to that particular population. And the more it'll be clear to them that you're taking the time to understand.
Great advice. I think one of the biggest changes for me was I went out to a tournament in Los Angeles and I went to an arena. And I think for everyone who's like, I just don't get it. I think when you go and you immerse yourself in the environment and you see it, you see the people, first of all, extremely friendly, welcoming community. Like it was wonderful. But then watching the competition, you're like, oh, I understand. Now it
And
just
if
makes it
you're
that much more real.
it definitely can be overwhelming. Some of the
Yeah.
games are really complex, really complicated, full of lots of fast moving graphics. So if you're looking for games that might be a little bit more accessible to start out with, my favorite one to always recommend is Rocket League. Because Rocket League is, I can sum it up for you in one sentence. It's soccer, but with cars. Uh, Rocket League is an easy one to get started with. If you want to get complex, sure, go watch a Valorant tournament, go watch a Dota tournament, go watch League of Legends.
That's what I saw was League of Legends, which
League of Legends is a heck of a
complexity
place to start.
the complexity does have an effect. At least it makes you appreciate, like, this is not, you know, this is not your father's video game.
Yeah. And if you want something in between, something like Counter-Strike, which has, a fairly kind of simple premise, but a lot of complexity in terms of strategy, might be a little bit more of the middle ground when you're trying to first dip your toes in.
Well, this is excellent. I mean, it just thank you so much for taking some time to spend with me today for this podcast. And I'm so in awe of everything that you've accomplished in what seems like such a short time, coming from when I first met you to all the good stuff you're doing now. And now you're in academia and bringing esports medicine into the curriculum, which is just fantastic. It, and obviously creating more opportunities for physical therapists, which is something that we're always looking for. But
Yeah.
thank you very much for the time, Dr. Caitlin McGee. And what's the best place for people to find you?
Let's see. At this point, the best place to reach me is probably my website, drkatemcgee.com, or just on LinkedIn. I am still on Blue Sky and Twitter, but Lord knows I don't check that nearly as much as I used to on a day to day basis.
Okay, great. Well, thank you and best of luck with everything moving forward.
Thank you so much. So glad to be here. Thank you for having me.